Here are the top 3 reasons why it's rare that weight is the main cause of hip arthritis. Now, unless you're 50 to 70 pounds overweight, then it's very possible that you can improve your hip arthritis without losing that weight. Let me give you some reasons why. Number 1 is, what about the other hip? You have 2, hopefully, and if you have hip arthritis on one side, and that's the one that's bothering you when you take a step and walk and get up and move around, well, what about your other hip? Because every time you go walking anywhere, you walk through your home, you walk at work, you walk in life, at the store, wherever you go, you have to bear weight fully, your full weight on the leg that you're standing on whenever you take steps. So your other hip, your good hip, is taking on weight too. Why didn't that one also develop hip arthritis to the same intensity as the one that's bothering you? Now, you could reason that this is your dominant side, this is the side that you get out of the car in, or this is the side that you move a certain way to usually, but your other hip is just as old as that hip, and your other hip takes roughly the same amount of force and activity. You have to have some extreme activity that you're doing in order for it to be out of balance so much that it's truly the cause for you getting hip arthritis. But if you're thinking about your weight being the cause, both sides carry the same amount of weight most of the time, so it can't just be the weight, there's something else at play. Reason number 2 is, what about thin people? They get hip arthritis too. How is it that somebody who doesn't weigh a lot, doesn't have a lot of extra weight on them, can get hip arthritis? That means that it's probably not always weight related. And if you've put on weight recently, especially as a result of having hip pain from hip arthritis, then you might feel guilty, especially if you went to a doctor and they told you that you needed to lose weight, because yeah, maybe over the past year you've put on 10, 20, maybe even 30 pounds, but in truth, you haven't been as active because your hip's hurting you. You haven't been able to do the normal routine that you usually do. You haven't been able to go to the gym or exercise like you like to. Even just your daily routine, the errands that you run, the activities, the chores that you do at home are probably not happening to the same extent that they used to before you had hip pain. And so if you gained a little bit of weight, that doesn't mean that that's the reason for the hip pain. It's usually a result of the hip pain. But there are people out there that are real thin, that are very skinny, that have hardly any fat on their bodies, and they have hip arthritis. They come into my clinic, and it is obviously not a reason for them having hip arthritis. Weight, they're light, they don't weigh much, but they still have hip arthritis. There's something else at play. And reason number 3, here in the clinic, we see people get better all the time because we focus on strengthening the right muscles and compensating with strength for any excessive weight that they may have. Now, 50 to 70 pounds is kind of the sweet spot. Once you're beyond that weight, and I give a range because depending on your size, if you're a smaller person, 50 pounds is going to be a lot of weight. If you're a bigger person, then 50 pounds may not relatively be that much weight. Maybe 70 or maybe a little bit more is going to be what it takes for weight to become the main reason or a priority reason for your hip arthritis. But in that range, if you're below that range, if you've just put on 10, 20, 30 pounds overweight, then it's possible for you to just up your strength so that you can carry that extra weight safely and it's not negative, it's not harmful for your hips. So it stands to reason that if you gain more strength, then you can carry the extra weight and allow your hip joint to feel better because you have the strength from your muscles to support it. This is exactly what we do with our clients here because what we're focused on is treating the root muscle imbalance, which is the main cause of hip arthritis. And if we can fix the muscle imbalance that sets up hip arthritis, then weight is not as important of a factor. And what we see often is we have patients coming into our clinic telling us, yeah, I'm here for hip arthritis. Doctor told me I need to lose 20 pounds. And I'm looking at them and I'm thinking, I think if you lose 20 pounds, you're probably going to be the thinnest you've ever been in your life. And you're 60 plus years old, 70 years old, and it's not realistic to do that. You're not going to feel great. It's just going to take you so much more effort than if you did exercises for a couple of months to boost up your strength because you're obviously weak in certain muscles that set up the muscle imbalance, then you're going to be much better off. And would you know it, after doing that for a couple of months with these patients, they feel tremendously better. And they didn't have to give up their lifestyle, their eating habits. And I always tell them, look, you can lose the weight, totally fine, but that's not the root problem. It's not going to make you feel better in the long run. And this gets people stuck into a vicious cycle of, I'm trying to lose weight because my doctor told me, but in reality, the doctor doesn't understand root muscle imbalances and the cause of hip arthritis. They're just seeing, well, of all the things we could work on, it looks like you could lose a little bit of weight or maybe a lot of weight. Let's try that first while we're trying medications and injections and other things to help you with your hip arthritis. Now, if you're looking for guidance on resolving hip arthritis at the root of the problem, at fixing the muscle imbalance, I've got a program called the Hip Arthritis Recovery Program. It is a detailed program. I'm comprehensive in this program. I go step by step from beginning to end, from very severe pain, can't walk on your hip, all the way to being active, lifting weights, getting back to feeling normal again. This program walks you through all that. It's over 30 videos of me coaching you through how to naturally heal hip arthritis so that you can avoid relying on pain medications, not have to go to the doctor for injections, and avoid an unnecessary hip replacement surgery. Go check out that program, learn more about it. There's a link in the description below here. And I've also got a playlist called the Hip Arthritis Help Playlist. You'll find a link to that playlist down below. It's all our videos that relate to hip arthritis here on our YouTube channel. Hey, I hope this video was helpful for you. Thank you so much for watching. Please give us a like, give us a thumbs up, comment on here if you have a question, and please share this video with somebody you know out there who's been trying to lose weight for hip arthritis, to help their hip arthritis, and it's probably not the best thing for them to do because they're not that overweight to begin with. Thanks guys, and I'll see you in the next video. Bye-bye.